Hi, my name is Jimmy Diaz. I'm a medical doctor here at Quest Center. Today we're going to talk about your arteries. We're going to talk about what they do and how they get sick and what do we need to do to make them better. Okay, I think that circulation is one of the most important things for your health. Your circulation is important because your blood flows inside of your arteries. They come back to the heart to be pumped again in your veins. It's a harder flow in your arteries. We need to have arteries that have a good diameter so that the blood goes through the red cells, the white cells, the platelets. And as we age, we clog the arteries with cholesterol mostly and with heavy metals. Plaque, what we call plaque, is something made of cholesterol, heavy metals, platelets, and the plaque itself is very disruptive to your health. As it clogs your arteries, the arteries get smaller and smaller, and then no blood can flow through them. Normally we are born with perfect arteries. The babies have perfect flow, there is nothing wrong with them. As we keep eating, as we keep doing things that are not good for us, for example, very high cholesterol diets, very low fiber diets, diets with a lot of chemicals, diets that are deficient in nutrients, and we get exposed to heavy metals like lead and other metals like aluminum from cans. Uh, Obviously, we will have problems with our arteries. In the Vietnam War, we noticed that our young men, 19 and 20-year-old, they were having already clogged arteries. They were already having plaque in their arteries. Since then, we have getting worse because there's more consumption of fast foods, there's more exposure to metals. So as we age and we start in the 40s, our arteries are already getting more hard, plaque is into them, and we start to get high blood pressure, which is one of the first things that we get with hardening of the arteries. As your physician gives you blood pressure medicine and it gets better, we tend to forget about that. But then 10 years later, 15 years later, we start to have evidence of claudication, which is when not enough blood goes into the muscles. And we start to notice that we get tired easy, that as we walk, we get pain in our legs, and then we start to get chest pains, which means that the arteries in our hearts are getting clogged. And then we start to get evidence of this happening in the brain, with the microcirculation in the brain getting compromised. When we get that, then we start to get forgetful with simple things. First, I don't know where I put my keys, and then I don't know where I came in the room for. Eventually, you will get really forgetful with faces and names, and your calendar really gets bad because you don't remember that you're supposed to be at this meeting or to do that. And that's a very advanced moment in your life. So what do we do? First, we need to understand what is plaque made of. Plaque is made of heavy metals. Plaque is made of platelets. Is made of cholesterol. So, to improve your circulation that has been compromised because of plaque, then we need to go ahead and first change our diet. The way that we process our food today is terrible. So we need to go into an organic diet, cooking well, having less animal products, more plant products, and then we have to measure the amount of heavy metals in your system. For that, we do something we call provocative test. We provoke your tissues to release heavy metals, and that will be something that we can measure in your urine and your feces, and then we can tell what we need to do about that. The cholesterol that's been deposited there needs to also come off. So the treatment of choice at this time, it is something that we call chelation for the heavy metals. Chelation is a substance called calcium EDTA that helps to bind to these metals and remove them from your body. Another treatment that we have for the cholesterol part of the plaque is called plaque X. Plaque X. That is a type of substance that helps remove cholesterol from your blood, eventually from your arteries, and the combination of that will eventually bring arteries that are more pliable, that are stronger, more circulation goes through them, and your body comes back to function. For example, your mind gets better, you can exercise more, you can do more. In men that have problems with erection due to circulation also get much better. Ladies that have problems because their hormones were not doing well due to poor circulation into the ovaries and adrenals start to also get better, and the body in general will react in a very positive way. You may contact us uh, uh, through the internet, or you may contact us by phone to be evaluated and see if this is a problem that you have, and it's something that we can do for you. We'll gladly do for you. God bless and thank you.